Hi, welcome to Shippydoll Registered Nursing. Hi everyone. So today I want to kick off a little series that I want to start about critical thinking and how we think critical as a nurse daily without even recognizing that we are. So in nursing school, right, as nurses, we get the word thrown at us. Critical thinking are the words. Critical thinking, you need to think critical as a nurse, you need to think critical as a nurse, especially as a new grad coming in. You're like, critical thinking, how on earth do I think critical? Well, Shippydoll Registered Nursing is here. So, critical thinking, whenever you hear that phrase, critical thinking, I want you to think safety. Critical thinking, safety. Critical thinking, safety. So always think safety. Whenever you hear the word critical thinking, think safety. Because when they say to you, think critical when you're taking care of your patient, that means you're going to be practicing safely as a nurse. So whenever you hear that term, that's why I say think about safety. How am I treating my patient? How am I providing quality care to my patient, which in turn I'm going to receive the best patient outcome? So that's the reason why I say that. And whenever you think like that, I'm telling you, critical thinking is going to be very easy for you. It's a breeze. So listen, I want to first give you, I wrote down a definition. Listen, critical thinking involves identifying a problem, determining the best solution, and implementing an effective method to resolve the issue using clinical decision-making skills. So it's basically your knowledge, your skills, whatever you were taught, all of that combined together in one. You're using all of that to think critical. You're evaluating, you're assessing your patient, and now you're going to implement the strategies that are needed and the care, the treatment, right, that are needed to take care of this patient to the best of your ability, right? So we're filtering out all of the irrelevant information and we're paying attention to the details that's needed to take care of that patient, because each care is specific to the patient that you're taking care of. And for example, I want to give some examples because then it's going to be easier for you to think that, okay, really, that's critical thinking. I'm doing that every day. For example, patient blood pressure is low. You have blood pressure medication to give to this patient. You have iodine, which is a very strong blood pressure medication, I believe. Will you give this medication or will you hold it and contact the doctor? If you give this patient the medication without checking the patient blood pressure, knowing that the patient blood pressure is low, you are not thinking critical and you're practicing unsafely. Whenever you do the opposite, you hold it, you make certain you check the patient blood pressure. Patient blood pressure is low, you hold it, contact the doctor. You need to do all those three things. And if you didn't do that, then you're not practicing safely and you're not thinking critical as a nurse. It's basic. That's what you need to do. So another thing, you're going to give blood. You're going to take the patient vitals. If it's off at all, if any number is off, I am messaging the doctor. I am contacting that doctor. I'm getting to the doctor before that blood it's my patient vein, because I need to know, should I hold off? What are we doing here? Are we going to pre-medicate this patient? Because if the patient temperature is 101 before you even start the blood, like what's going on here? Fever is a reaction, it's a sign of reaction to blood. So I would never give a blood product if the patient vitals are off. Never. So first, you need to contact the doctor. If you are scanning that blood is giving any error, don't administer it. Contact the doctor. Contact the doctor first. All right? That's thinking critical, and that's practicing safely. And that's the reason why I say, whenever you think about critical thinking, think safety. And whenever you think about it like that, critical thinking is going to be a breeze for you. All right? And I've never heard it like that before. I literally was just reading and thinking about everything. And I'm like, critical thinking is basically practicing safely as a nurse. And if you can think critical thinking, safety, you got it. You got it. Critical thinking, safety. And there are some components to critical thinking that I wrote down that I really liked. And one of them is reflection. And that is reflecting whenever you're done with your day. And I do this all the time. Think about your day. Like, what could I have done differently? What happened today that I, as a nurse, could have done differently? How could I have treated my patient differently as a nurse today? What did I didn't do? What could I have done? You know, and question yourself and evaluate yourself in that way, because you see, whenever you can speak to yourself, question yourself, and self-evaluate yourself, you're on to greater heights and being a strong critical thinker, because you cannot lie to yourself, and you know that you can't lie to yourself. And so when you evaluate yourself and see what I can change to be a better nurse and to be a strong critical thinker, you got it. You're there. And because you're always going to be curious, and a critical thinkers are people that are curious, strong critical thinkers. They're curious. They take criticism. You know, they're always looking to be better. They always want to grow, because whenever you can self-reflect, that's going to help you to grow to be a strong thinker. They're always questioning things. Like, someone not going to just tell you, oh, do this, and then you're going to be like, you're going to start thinking, why are we doing this? Even if the doctor gave an order, you want to know, why are we giving? If you're given heparin, you're like, why is this patient receiving heparin? Patient came in for high blood pressure. Why are we giving heparin? Why are we running heparin? It must be something that they found, right? Why? Because if the diagnosis is hypertension, and here we are giving heparin, we're running heparin 8.6 ml per hour. Like, why are we giving that? So critical thinkers, they're thinking and they're questioning things, so they know the details. They know what's going on with their patients, so they know how to treat their patients, right? So we have to do these things in order to become a strong critical thinker, and always think safety. Another component, let me see, prioritization. So when you prioritize, you are treating the most critical patients, right? Because that's what prioritization, when we prioritize with patient care, we're treating the patient that needs to be treated urgent, right now, or that one takes priority over another patient based on what's going on with them, their level of care that's needed. So that's a component also. So they go in hand to hand. We're always saying nurses need to learn how to prioritize. And when you think about it, that also comes down to safety. Because if I know I have a patient that needs to get insulin right now, because their blood sugar is 500, why am I going to go to a patient that just needs to eat breakfast? They don't need no insulin, they're just a feeder, need to be fed. We have no PC on the floor, so the nurse will have to do it. But here I have a patient over here that have insulin, that their blood sugar is 500, and I need to give this patient insulin and contact the doctor right away. Why am I going to go to feed that patient? Because the patient is yelling and screaming that they need to eat. No, it doesn't take priority. The patient that their blood sugar is 500 takes priority. Not because the patient is screaming and yelling and everyone is hearing that patient. That doesn't mean we're going to go to that patient. We're going to prioritize the patient that is most critical. And that goes hand in hand with thinking critical as a nurse. Right now, right then, you have to be thinking. You have to be paying attention to the details. So that, my friend, is the beginning of our series of Thinking Critical. I am going to do some more research and some more reading along with my knowledge, but I just want to bring it across the best way possible so that even new nurses, new grads can understand. Listen, this is not something that you need to be scared of, that you need to run from and say, oh, I don't know what to think critical. No, or they train it on you. Oh, critical, you need to think critical. And you're like, how? Because as a new nurse, I'm like, how do I think critical? But then I come to the realization that I am thinking critical. But has anyone ever explained to you critical thinking while in nursing school? Maybe not. They just tell you to think critical. Yeah. So Shippydoll Nursing is here to your rescue. I hope you enjoy this video. Please tell me how you think critical as a nurse, what you would do, and if you have any examples, anything that you can put in the comment below that will help someone or even help me, please comment below and add it there. Remember to like, subscribe, share the video. I will be back with more. Thank you for watching. So right now I am in Jamaica. Before I go, let me just show you outside. Give you a little beach view. Right? So it's pretty, right? Okay, so bye. Remember to like, subscribe, and share the video.